Locke. Pamela, welcome. So Pamela, you're the project manager of, now tell me, Doc Online?
Doc Online,
Doc Online,
yes.
okay. I haven't heard of this before. Sounds like something new's coming about.
Yeah, it's new, it's not yet out there.
Yep.
We're going to provide GP consultations for all of New Zealand using secure virtual video.
Right. So
Yeah.
it's going to be like a new virtual GP clinic.
Yes, it's not going to be to replace someone's own GP. It's going to be in addition to complement their own GP. We won't be able to see every condition. It'll be mainly minor things and things that are really safe to be seen in this manner without doing the hands-on investigations and examinations.
Cool. Sounds really good. So how does something like this come about?
Well, this is something that we've modelled from overseas, and New Zealand is behind somewhat in the virtual world of medicine, and it seems to be really effective and seems to be embraced by different communities around the world. And we think that there's a need in New Zealand because we've got a vast geographic area. Not always is there a GP within proximity of where people might live.
So how would you visualise this to happen? So sort of, I can imagine you'd want to address the distance of people being spread out so much, particularly like up in areas like Northland and down in the South Island. People are very, very spread out. So this is going to be a great idea to try and meet the needs of those people.
Yeah.
Is that kind of what you're visualising here? Is it going to be like a 24-hour service, or is it?
It will cover after hours.
Okay.
The research shows that midnight isn't a particularly popular time for people to need to call a GP, for example, and we're not an emergency service. But we will be offering after hours service and weekend service.
So I guess why has this service really come about now in New Zealand?
Well, I suppose it's just been 2 months, and the Medical Council have made a change to their telehealth statement, which has allowed for this to happen, and it's happened across DHBs as well as private sector, and it's just opened a door for people to access health in a different way now.
Okay. So I guess one of the challenges with setting up something new like this would be having boundaries like the medical, I've just been leading at this conference, the Medical Council, their statement about e-prescribing or prescribing over the video linking.
Yes.
My understanding of it is that you can't prescribe over the virtual TV without meeting the patient.
Yeah, so the Medical Council have stated that if you don't meet somebody in person prior to a video consultation, you're not allowed to prescribe to that person unless there's an exceptional circumstance, such as no doctor available in the area, or there's an urgent need for prescribing. In a lot of cases, the sort of medicine that we want to be working with is the risks are managed, and there's not the risk of complications as a result of prescribing. In a lot of cases, it will be because of convenience that people will want to access our service, and there might well be an after hours service in the area. But for example, they might have small children and they're in bed asleep, and they don't want to have to wake them up and take them all into the after hours service. So in regards to the Medical Council statement, it's sufficiently vague to be able to fully understand what that means and what the limitations are around prescribing to people that might or might not meet these exceptional circumstances.
Okay. So this brings up a good discussion, doesn't it, about the way we're managing healthcare, trying to move it in parallel with the advances in technology. Essentially, if you've got a virtual GP clinic, we need councils and guidelines within New Zealand to be keeping up with us, don't we? So I can imagine it without meeting somebody, it creates a bit of a barrier, having that prescribing from one end to the other if you have to meet them first. then that creates a barrier to using a service like what we have. Except for, you mentioned that clause, didn't you, with the no doctor available and instead of in an urgent matter.
Yeah, and it's open to interpretation. So that's where the ambiguity is and where the difficulty is in allowing doctors to do that. It's, if there's an after-hour GP available in that proximity, but you still have to travel a distance, is that considered a doctor available? Compared to, in most of these areas, if you're prescribing, there actually wouldn't be a pharmacy available after hours anyway, and so it's saving that person having to go to the GP the next morning, for example.
Yeah, and Doc Online is going to be a great resource for that, because I mean it addresses so many barriers. I mean, you're talking about access, you're talking about transport, time, money, work. Parents who have kids and they want to keep them asleep. I mean, just the click of a button is going to achieve so much.
And remote people. My cousin's a farmer in Waihi, for example, and he would have to travel an hour to get to an after-hour clinic. And there's a lot of areas within New Zealand where they still have an after-hour doctor on call or an after-hour service, but it's still a distance that they have to travel, and the convenience of that when somebody's unwell, or by putting healthcare back into the hands of the consumer, convenience is actually a component to that, and patient choice in regards to that, when it can be considered very safe for their safety.
I've always had a quote in my life where I've always wanted to bring the healthcare back to the gate, sort of farmer's gate, I guess you would prescribe in your example. And this is a totally different way of thinking about it. I mean, we've got access to internet and virtual worlds now that we can bring healthcare back to the gate in a virtual sense. So it's going to be great. Oh, I look forward to hearing more about this, and hopefully its development in the future.
Thank you.
It's lovely to talk to you, Pamela.
Thank you.